Prepare to experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host, Carl Lenore.
Hey, welcome back to another episode of Superhuman Radio. This is show number 2783. Can you imagine that? We have done a lot of shows, and this November will be 16 years of continuous production of this show. And we average the lowest we ever do is 3 shows a week, and most of the time we do 4 to 5 shows a week. I don't know anybody else who produces the content that this show produces, but it's all about getting information out to people before the mainstream does. Really, that's all we want to do. That's why a lot of our shows focus on emerging studies, emerging technology, and we tend to talk about things way before anybody else does. Years. Peptides. I was talking about peptides in 2006. Intermittent fasting, 2008, when the first study was done by Dr. Mark McCarty on rodents. So, if you tune into Superhuman Radio with any regularity, you'll hear about stuff that maybe in 2, 3, 4 years you'll hear about when you're watching one of the morning shows. We have a fascinating show today about light therapy and Alzheimer's disease. Light therapy has been proving to be very powerful for a variety of therapeutic conditions. And we'll be talking with Dr. Mariana Figueiro to talk about some emerging research and some directions that research is going in the case of light therapy and Alzheimer's disease. Before we do any of that, we have to thank our title sponsor, and that is Legendary Foods. Legendary Foods started out to make a healthy alternative to the Pop-Tart. The Tasty Pastry was born, and it's become so much more. The Tasty Pastry tastes really like you're eating pastry, like cake. In fact, people eat them because they're delicious, and the extra benefit that they have less than 1 gram of sugar and 20 grams of high quality protein is just an added feature. But it's a fantastic product. It comes in a multitude of flavors. If you want to learn more about them, you can go to shrnetwork.biz/legendary. If you decide to buy them, you can use the code SHR10 to save 10% off. I promise, if you buy them once, you will buy them again and again and again. And as such, we hide a secret word in every commercial break. And when you hear the secret word, if you take a moment to write it into an email and send it to onair@superhumanradio.net, along with your mailing address, please don't forget to include your mailing address. Legendary Foods will send you a care package that will knock your socks off. Joe Nasrallah got one, and he said, "Are you effing kidding me? I was expecting a box of tasty pastries, but what I got was amazing. I'm beyond ecstatic, thanks to Ron's generosity." So about Ron Penna, the owner and founder of Legendary Foods. And I love this one. I love talking about this one. Lucy and Izzy unboxing their free tasty pastries. Everyone has been enjoying them. Breakfast has been healthier, easier, and the kids think they're suddenly getting the same junk food their friends do. Kids love tasty pastry, and with less than 1 gram of sugar, it's a better alternative than a Pop-Tart for your children. So listen for the secret word. Email it to onair@superhumanradio.net. Get your free goodie package from the folks at Legendary Foods. Don't waste a minute. And now, without further delay, I bring my guest on. I've done all of my duties. How are you, Dr. Figueiro?
Hi, how are you?
Thanks for being here today.
Thanks for having me.
So, why this research? What led you to this point? What preceded what we're going to talk about today? Maybe things that you worked on, colleagues worked on. How did we get here with light therapy and Alzheimer's disease?
Yeah, I mean, it really started with, I was part of the Lighting Research Center, which used to be part of RPI, and then we now moved to Mount Sinai. But we really were focused on understanding how light affects people. And one of the most impactful ways was learning how it affects our circadian rhythms and our sleep. So I first started, one of my first projects was actually working in a newborn intensive care unit, giving lights to nurses at night to keep them awake. And that's when I got into this area of light and circadian rhythms. And then understanding a little bit of the theory, I said, well, wait a minute. Alzheimer's patients, they do have sleep problems. They do have unconsolidated rest activity patterns. Why can't we try this in Alzheimer's disease patients? And that's really where it came the idea. And then, in addition, there was a researcher in the Netherlands who did one of the first studies where he just increased the amount of light in nursing homes. And he saw that the Alzheimer's patients were sleeping a lot better, were less depressed, were less agitated. And I said, wait a minute, why can't we now tune the light and implement a specific tailored lighting intervention to help them with that?
So what is it? Is it more sophisticated than just trying to emulate what sunlight provides?
Well, it in a nutshell, no.
To keep people awake, I'm talking about.
Yeah, I mean, it's not. It really, I mean, the best thing you can do is really go outdoors and spend your time outdoors during the day and then not get a lot of light at night or in the evening. However, we're spend 90% of our times in the built environment. And if you think about Alzheimer's patients, they're almost 100% inside nursing homes or assisted living facilities and so on. So we really lost that interaction with the natural light. So the question is, how can you now use the electric lighting system that you have? Not to mimic, because you really can't mimic what you get outside. It's too much light outside, and it would be too much energy consumption. You can't mimic, but can you tailor the light? So what we were trying to do is understanding how the eye responds to light. Mm-hmm. And then by understanding that, you can then develop light sources that can be tuned to that response. So that's really where the research that we did had a two-pronged approach. One was more in the lab, trying to understand how the eye responds to light. And then the other one was like, well, how can we then develop those lighting solutions that can provide that to the patients? One other important thing about it is also you have to make sure that you have light reaching the back of your eyes. And I think that we don't think about that when we do lighting in the built environment. So that's another trick that, it's special. It doesn't sound special, but it's something that we don't do it normally.
So a lot of elderly people have iPhones now, and they're in the nursing home and they're staring at these iPhones. And we know that older people have trouble sleeping. We know that there's a link between fragmented sleep and the onset of memory loss due to poor memory consolidation, as you referred to a minute ago. Is this new novelty gadget creating even greater problems? Now not only they're indoors all day long, but quite often we know blue light is the signal for circadian rhythm that it's daytime. And if you're looking at your iPhone up until 10, and then you turn it off and you lay down and think you're miraculously just going to fall into deep sleep, we know that looking at your phone up to a half hour before bedtime causes deep sleep latency up to 2 hours. So are these iPhones creating even greater problems for people who tend to be susceptible to Alzheimer's disease?
Well, I think it could be, and it could be creating not just for people susceptible to Alzheimer's disease, to all of us. And I think what happens is what's very interesting about the iPhones and the iPads, first of all, they're becoming bigger and brighter. So, the newer, the bigger, you now have the iPads, they're getting bigger, and screens are getting bigger. And the other thing is they're very close to your eyes. So what happens is if you think about a television, for example, television can be big and bright, but you're far away from it. So you don't get enough light from a television to affect your biological clock. But you can get from an iPad, for example, that is very close to your eyes. Now, what's most important is timing, and we tend to forget that. You're absolutely right that half an hour before going to bed, it's the worst time that you can give yourself that amount of light, because what you're doing is you're delaying the onset of melatonin, and melatonin, it's a hormone that we normally start producing about a couple of hours prior to your normal bedtimes. So if you delay that onset of melatonin in the evening, you're delaying that signal to the brain that it's nighttime and it's time to go to sleep. So yes, you could be making it worse by giving that light. You can also be making it worse by simply alerting yourself, because now you are reading something that it's exciting, or watching a movie that it's exciting, or reading something that is exciting, that you're alerting your brain, which makes it hard for you to wind down and fall asleep.
It's interesting. I did an interview with a woman whose name escapes me. It was probably around 2006, 2007. She had authored a book called Lights Out, The Cure for Type 2 Diabetes. And the book had a very simple premise. Live by the sunrise and sunset. Turn your lights off in the house. When the house gets dark, go to bed. When the house gets light, wake up. And people who followed that book said miraculously their insulin resistance vanished in months, in complete months. But it's a very hard thing to do, because creature comforts are very popular with us, the iPhone, the iPad, these things, we're just fascinated with them. So when we talk about dementia, I understand, even from when Dr. Bredesen was on the show, there are people who have genetic predispositions. And what the genetic predisposition basically is if you do the things that trigger this genetic predisposition, you're going to get this disease. But that also means if you don't do the things that trigger this genetic predisposition, you won't get the things. And we see that in twin studies on BRCA genes and everything else. So are we ready to tell people, and I know people hate this because no one wants responsibility for giving themselves a disease, neither do I, but are we ready to tell people that by and large, the majority of people with Alzheimer's disease acquired it because of their lifestyle?
I don't know if we're ready to say that, but I would take a conservative position that if we don't know, that means we shouldn't do it, right? Even if we can't for sure say that it is acquired, because I think it's a complex disease, that there's a lot of things associated with it. But I also think that if we don't know enough, take the conservative approach and don't disrupt yourself, don't insult your body with things that you don't have to. And this way, it's at least a protective mechanism that you would have. And honestly, this is really, you can't really control your genetics, but you can control your behavior. And I think that that's the only thing we can do. And the way I see light and light exposure, and exposing yourself to a robust light dark pattern, which is, I believe, a healthy thing to do, it's really about you deciding you want to do, just like diet and exercise. So turning off your iPads, an hour, 2 hours before you go to bed, it's a decision you have to make. And honestly, I think that until we know better, why not make it?
No, I completely agree with you. So let's talk. So there are two specific light therapies that your group is focusing on as you move forward with this grant to investigate the effects of light therapy on Alzheimer's. Can you talk about them individually? What's the first
Sure.
one?
Sure. So the first one is actually one that we have been working with since 2010. And that is really delivering a very robust light dark pattern to Alzheimer's disease and mild cognitive impairment patients, so that you maintain entrainment. And by maintaining entrainment, circadian entrainment, you will sleep better, because your sleep wake patterns, they are influenced by the timing of your biological clock, because your clock tells you go to sleep at certain times and be awake at other times. Because we're diurnal species, your clock sends you an alerting signal during the day, a sleeping signal at night. Now, if you're misaligned, these two things are not aligned, you're not going to sleep well. So by giving this robust light dark pattern, we're helping with this alignment between your biological clock and your sleep wake cycle. So that's the first sort of type of intervention. For that, it's blue. Okay, so blue light is the most effective one. Now, do we need to have blue light? No, we can have your regular incandescent light bulb if that's the only thing you have. You just need higher amounts of that type
Brighter,
of light.
brighter.
Brighter. That's exactly right. So the blue has the advantage that it doesn't have to be too bright, but it doesn't mean you can't do it with anything else. So like I said, go outdoors and sit on your porch. That's good lighting that you're getting. So that's the first intervention. We have had a lot of success with that, reducing sleep disturbances, reducing depression. It was absolutely amazing the impact that this lighting intervention had on depression in Alzheimer's patients and in the caregivers too. Because obviously you think about improving the lives of the Alzheimer's patients, you're also improving the lives of the caregivers.
Yeah, I know.
We tend to forget about
I
it.
was a caregiver for my mom, and you become. I started crying at the drop of a hat. I didn't know why. I was as depressed as she was, and she was the sick one. So I
That's
know.
exactly right. And we saw the benefit for both. And we saw a reduction in the agitation. So now we're looking at more in the cognition part, memory. We're doing studies where we're actually measuring sleep at home. So now we're expanding that work in the circadian entrainment part.
Mhm.
And then the novel technology that we're adding to it, it's the 40 Hertz gamma oscillation. And that's really, if you think about a light that, that flickers, you can see the flicker, it's really at 40 Hertz, that light. And there has been work mainly in animals, and people are starting to do clinical trials now where they are showing that this 40 hertz stimulus, and it could be done by light, it could be done by sound, or it could be done by a combination of light and sound. And that stimulus, what it's doing is entraining gamma waves in the brain. And that gamma wave in the brain is associated and linked with cognitive memory, as well as even in animal models, they're showing that it's cleaning the debris or the plaques in the
Yeah.
brains in Alzheimer's. So what we are hoping to do now with this study is combine those two to see if we can have an additive effect. So they're sleeping better because they're getting that circadian entrainment light. So we know that sleep, as you mentioned earlier, it's a risk factor for Alzheimer's disease. So
Right.
if you sleep less, you accumulate more plaques. Why is that? When we are awake, we're actually we're accumulating these plaques. When we sleep, we clean up these plaques from the brain. So by not having a consolidated sleep, we're reducing that cleanup from the brain and allowing more of the accumulation. So we hope that we're going to reduce the plaques by first helping them sleep better by that entraining light. And then we're going to give, in addition, we're going to give the 40 Hertz flicker. So we hope that have a double effect there. And that's what we're going to be testing in the lab and in the field.
Do you think pulsed electromagnetic fields at 40 hertz may have a value in this discussion at all?
You know, I don't know. I mean, if it's something that you are being able to deliver and see it from the eyes, I believe that the
Yeah, no,
sound.
you can't see it. You can
But
feel
if you can't, yes, I don't think the EMF would have the same effect. We are seeing the sound again that you're delivering through the ears. So I think that by not being able to have something that you need to be able to perceive, and your brain needs to be able to entrain to that stimulus. So if it's not something that you're not able to hook up and entrain to it, you're not going to see the effect that it's needed.
So I had Dr. Bruce Ames on the show over a decade ago, and he was the one who started introducing methylene blue, out of patent, pennies of a dose. One of the original synthetic dyes used in science. They found out that it was very effective in helping people with Alzheimer's disease literally rid themselves of symptoms. And he explained to me that the plaque was the result when there's fragmented sleep, the endoplasmic reticulum, which is the telegraph office of every cell that sends messages, intracellular messages from one cell to the other. When there's fragmented sleep, the endoplasmic reticulum starts to send out bad syntax, bad messages. And these become aggregate or plaque. They have no purpose. They're not received by other cells. They stay out there, and then they become sticky and they stick together. And that the role of deep sleep, which is probably the most important part of sleep, is to turn on autophagy, which is the cellular sanitation system that goes out and breaks down all of this debris and gets rid of it. So you're talking about using 40 hertz light, it sounds like to me, to stimulate on-demand autophagy. Am I understanding that correctly?
Yeah, I mean, in a way, that's what in animal studies, again, there hasn't, I know that there are initial studies with humans, but there hasn't been a lot of data available. But in animal studies, that's what you're seeing. You're seeing, an engulfment of the microglia, which is helping to clean up those debris in the brain or the plaques.
Interesting. Another question I have for you is REM. So if deep sleep is the reparative sleep where the body cleans up and fixes things that are broken, REM sleep is kind of like the hard drive defragmentation process where events of the day are cataloged and stored in different places. And we call REM sleep because during this phase of sleep, the eyes are just, if you look at somebody who's in REM sleep, you think, oh man, what's going on with them? Their eyes are just tracking back and forth and back and forth. Is there a way to tap into that and use that in reverse to stimulate REM sleep to help people consolidate the memories that didn't get consolidated the night before because they didn't experience REM sleep because of constant fragmentation of their sleep?
Yeah, I haven't seen anything out there that have been doing that. Even though I did see studies that I think just got funded now, and they're about to start, which is the TMS thing, which is the sort of the brain. You put kind of a hat on the brain and you stimulate the brain from outside. This is not with light. This is just brain stimulation through the skull.
Fields, yeah.
That's right. And they're looking at whether this can help increase, but they're looking more at deep sleep. Nobody's looking at the REM sleep. Now, one of the latest research that I've seen is what they're showing is it's really about sleep duration. So what they're saying is and again, nobody knows if it's 15 hours of sleep or 18 hours of sleep is what you need, or if 7 hours is enough. But it does seem like if you start reducing to 6, 5, 4 hours of sleep at night, you are seeing that impact. And remember, when you reduce your sleep to 4 or 5 hours a night, what you're mostly taking away or leaving behind is the REM sleep. Because the first few hours of your night, you are doing deep sleep.
Right.
That's when you get deep sleep. So if you only sleep 4 to 5 hours, you are getting the deep sleep in, but you're not getting the REM sleep. And that is affecting your risk of Alzheimer's too.
Yes.
So there's clearly a role for the REM sleep in the whole process, but I don't think we know yet what that role is and how to increase that, because a lot of the focus has been on the deep sleep, but I think we need to think of sleep overall, the whole night of sleep with all the cycles.
The other thing that we can't ignore is that people who have short sleep, we've done studies on this with Olympic athletes who were forced to sleep only 5 hours a night, and they developed blood sugar management issues like 20-year-olds. The other thing that we can't ignore, and it's hard to tease out, is the dementia a result of insulin resistance of the brain, a separate type of insulin resistance that occurs because people who don't sleep tend to become insulin resistant. And when you look at that, and you look at the work coming out of the University of Southern Florida and Dr. Dominic D'Agostino's group, and the work with ketones, they're taking people who have full-on dementia, and they're giving them ketone esters, and they become lucid and cognitive for a couple hours, and then it fades away because the brain is unable to metabolize glucose. So you're trying to run the engine with no gas, but the engine also runs on ketones. And when you give them this alternative substrate, people are clear-headed. They don't seem to have the symptoms of dementia again. So my question is, when we look at these sleep problems, is the sleep problem the extrinsic effect, and the intrinsic effect is that these people become insulin resistant in their brain?
It could be, and it also, which is also related to that insulin resistance, it's also inflammation. You know, you tend to have, they have been linking Alzheimer's disease to brain inflammation, which is also associated with, insulin resistance.
Yes.
So I do believe that it's everything is around sleep. I mean, you don't sleep well, or you curtail your sleep, you are increasing your risk for diabetes, for obesity, for cardiovascular disease, for Alzheimer's disease, and all these things are interacting with each other. But the real core of it is sleep. It is absolutely amazing how important sleep is for health. It's just something that we take for granted. We say, I'll sleep when I get older, or I'll sleep when I'm dead. You hear a lot of people saying that. I'm like, it's a mistake. Don't do it.
I blame one person and one movie on this phenomenon where sleep is optional. The movie Wall Street that came out in the 80s.
Oh, yeah.
And Bud Fox is talking to Gordon Gekko, and Gordon Gekko is on the beach with his Motorola 8000 iPhone, bragging that he had been up all night doing stock trades in Japan or whatever. And he said to Bud, "You don't make money while you sleep." And people went, "Oh, that's the secret. I'm going to be up all night if I want to be successful."
Yeah.
People that still believe this today. I'm not going to mention names, but I have a friend who's a wonderful guy. He was building a company. He was bragging about how he's not sleeping. A year later, he was diagnosed with colon cancer. Now, did they have something to do with each other? I don't know. But we've covered studies that show that third shift workers have like a 5-fold increased rate of colon cancer.
That's exactly right.
Sleep is not optional, people. If anything, it should be your number one job to fix your sleep if you have any disorder today.
Oh, and I absolutely, I mean, I think it is very interesting how we spend a lot of time thinking about dieting and thinking about exercise, which is important.
Right.
But we don't think about our sleep. And if you think about it, maybe if you sleep better, you're actually going to control your weight, and you're going to have more energy to exercise just by controlling your sleep and improving your sleep. So I am absolutely I cherish my sleep. I think there isn't anything, and I'm blessed because I don't lose sleep over anything. And it's, to me, I have to have my 7-8 hours of sleep, and I have it. As busy as I am, I will not curtail my sleep, because it's just not worth it.
We're talking with Dr. Mariana Figueiro. We're going to take one quick commercial break. When we come back, I have lots more questions. Stay with us. You are watching and listening to Superhuman Radio. We'll be right back. Redcon One's new BAR bar is the ultimate soft-baked protein-packed snack bar, powered by peanut butter. Perfect for while on the go to help curb hunger or sneaky sweet tooth cravings. With 20 grams of protein, use as a meal replacement bar or when you're in need of a high-protein snack. Eat a Redcon One bar as a midday snack or for fuel before an intense training session. Go to shrnetwork.biz/Redcon1 and use the code SHR25 and save 25% off these delicious bars today. Being superhuman means being conscientious about the choices we make. White Oak Pastures is superhuman when it comes to raising livestock. They're committed to animal welfare, land regeneration, and rural revival. They responsibly manage the entire process from the pasture to your doorstep. High-quality, pasture-raised, great-tasting meat from a farm you can trust. Full nose-to-tail selections. They even have options for your pet. Go to shrnetwork.biz/White Oak and use the code SUPERHUMAN to save 10% off your entire first order. Every day, there's a new wellness trend. Eat that. Do this. Avoid those. How do you know where to start or who to trust? Inside Tracker helps you cut through the noise by analyzing your blood, your DNA, your lifestyle, and your fitness tracker to provide you with a science-backed, trackable action plan on how to live, age, and perform better. Personalized, one-size-fits-one recommendations to help you optimize you. For a limited time, Inside Tracker is offering Superhuman Radio listeners 25% off the entire store. Go to shrnetwork.biz/Inside Tracker, INSIDETRACKER, to save 25% off. Change begins on the inside. I would easily say that I am the hugest proponent you will ever meet to doing anything that will improve the quality of my sleep. And that's because sleep is linked to just about every metabolic disorder we see in our population today. One of the easiest things you can do to improve the quality of your sleep is to get a pillow that can be shaped into the exact form factor that allows you to get your best night's sleep. And that is MyPillow. I've been sleeping with MyPillow for a few years now, and I can tell you that when I have to travel and stay in hotels, I don't get a good night's sleep because I don't have MyPillow with me. Right now, you can save up to 60% off of everything offered to improve the quality of your sleep at shrnetwork.biz/MyPillow when you use the code SHR. Or you can call toll-free 800-889-4938. And remember to use code SHR to save up to 60% off of everything at their website. If there is one mineral you should be worried about not getting enough of, it's magnesium. Magnesium is the body's master mineral, powering over 300 critical reactions, including detoxification, fat metabolism, energy, and even digestion is influenced by the presence of magnesium. That's why I'm so excited to tell you about a new magnesium product I've been taking now called Magnesium Breakthrough. It's the ultimate magnesium supplement, easily the best I've ever seen or experienced. With all 7 forms of magnesium, I was able to arrange an amazing deal for my audience, and I guarantee it's the best deal available on this product. Seriously, with volume discounts combined with our custom 10% coupon code SHR10, you can save up to 40% off select packages of Magnesium Breakthrough. And I promise that this deal is only available on this specific website, magbreakthrough.com/SHR. You won't find that deal on Amazon or even on the company's own website. Go to magbreakthrough.com/SHR and use code SHR10 to save up to 40% off select packages of Magnesium Breakthrough.
You're listening to the Superhuman Channel. Don't hate us because we feel good.
Hey, welcome back. So I recently read a study. There's my dad and my mom both ended up with Alzheimer's at the end of their lives. And both of them suffered from a condition that is called sundowners. Mm-hmm. This is where people who develop Alzheimer's disease, they become very agitated at night. And a lot of times they become uncontrollable. You know, my father was a big guy. And he was, even in his 80s, he was not easy to control. And a study was just published that showed that a fairly large network of nursing homes started taking their most severe Alzheimer's patients out in the evening at sundown and let them see the daylight fade into night. And they went into their rooms and went to bed comfortably. And so I'm starting to think that sundowners is the inability for the body to tell what time it is.
Yeah.
It doesn't know, like, is it daytime? Is it night? And there's this sense of agitation because you don't, it's like not knowing where you are, you're lost, but it's your circadian clock that's lost.
Yeah.
And by allowing people to get the daylight and see the light going down, they know, oh, it's nighttime. It's time to go to sleep.
It's interesting because the first study that I did, it was exactly the same thing. We deliver the light in the early evening, like at 5 o'clock in the evening while they were having dinner. And we did see exactly the same effect. And it was an interesting study. I mean, it was a very small study in a nursing home, but we saw a significant consolidation of their sleep. And I think that, people always ask me, because for normal people, for you and I, people that are even for Alzheimer's patients, for humans in general, we tend to have a biological clock that's slightly longer than 24 hours. So we need morning light every day to reset the clock. And that resetting of the clock synchronizes us to the 24 hours. So everybody asked me, well, how do you explain that the Alzheimer's patients were actually responding to that light if you were giving the light in the late afternoon or the evening, not in the morning? And the reason why we gave it at that time, because we wanted to remove any possibility of having daylight into the picture. And I said, I think what happens is these patients have absolutely no light signal. They have a constant dim environment. And what we were doing is we're giving them a signal that they can lock on. And now they know that's time of day. And now they can at least lock on to something and they can have a regular circadian pattern. So it's very similar to what we saw in our studies, that by giving that light and then taking it away after an hour, you do have day and night. So now you can have that contrast. And that's what your body's looking for. It's looking for that contrast.
And let's not forget that this is a form of torture, like waterboarding. Putting someone in a dark room 24 hours a day for weeks drives them crazy. So this is these poor people, they're already messed up, and then you're doing this to them. They don't have any concept of day or night.
And I think what's most interesting is, I don't think a lot of people realize that, because if you get into a nursing home, you can see, right? I'm saying patients in a nursing home are in constant, quote unquote, darkness, which would be circadian darkness. Even though they can see in the environment, they're not receiving enough light for their biological clock, because you need more light to activate your biological clock. Then you need to activate your visual system. So you can navigate in the space with a night light at night, but that night light is not affecting your biological clock. So the fact that you can come in a nursing home and you can navigate in a nursing home, you think that, oh, they're being exposed to light in there. No, they're not. The light that they're being exposed to in there is just not enough to activate their biological clock. And that is, when we say darkness, you have to remember, it's circadian darkness. Just because the environment is not dark the way you see it doesn't mean it's not being dark for the circadian system.
Is there any evidence that people who are starting to develop Alzheimer's and they now decide, okay, I understand how important my sleep is, I'm going to fix my sleep. And we know from Dr. Bredesen's work that you can actually reverse the symptoms. He's not allowed to say he's cured Alzheimer's because there's no biopsy, there's no test, there's no way to go, oh yeah, it's gone. But if the symptoms are gone, in my opinion, you're fixed. And so people can reverse Alzheimer's disease by taking a lot of different unique lifestyle steps. With that being said, do you think that someone who has been sleep deprived, who's lived with fragmented sleep, they fix their fragmented sleep, they start doing circadian realignment, daylight, and so on, and now they're sleeping. Is there any value to like just going to bed one day, wake up, have something to eat, get back in bed and sit and just have a prolonged, I don't care what it is, 10 hours, 12 hours, 15 hours, 2 days sleep? Is that reparative, or once you lose that sleep, you can't ever replace it?
Well, I mean, I think you can catch up on your sleep, right? And in a way, that's what all of us, we do that on weekends. We tend to sleep in on weekends, and we catch up on our sleep. So what I believe can help, especially people with mild cognitive impairment, and we're currently engaged in a study where we're looking specifically at that, is that if you start increasing the sleep in people that are with initial dementia or with mild cognitive impairment, that they haven't necessarily transitioned to formally having Alzheimer's disease, what we hope we can do by increasing and improving that sleep is delaying that transition.
The progression.
It's delaying the progression of the disease. So even if we can't take away what has been damaged, we can at least minimize the continuation of the damage. So one way or the other, I think you win, and you should do it. And that's what we're collecting data right now to try to show that, hey, if you sleep better, you're going to be able to delay the transition to a more severe part of the disease.
I've been a firm believer that snoring in and of itself, without developing frank obstructive sleep apnea, but snoring in and of itself raises cortisol levels at night because the body thinks that it's having a hard time getting its breath. If you snore, you're not sleeping as well. Excuse me. You're not sleeping as well as if you don't snore. And I have talked about this for over a decade now. And I believe science is going to prove that I'm right someday. With that being said, those who have obstructive sleep apnea and or those who have really, bad snoring, their wife says, I got to go in the other room and sleep because he snores so loud, but he's not holding his breath. He's not stopped breathing, but he just snores so loud. They need to fix those things in order to have good sleep. Would you agree with that? I mean, when we're talking about fixing your sleep, that's probably number one for men, at least.
Oh, absolutely. I mean, sleep apnea and any kind of hypoxia, it's been shown that it's a very serious risk factor for Alzheimer's disease and for accumulating plaques and for all of that. Because what happens is, especially in apnea, what happens is deep sleep has 4 stages: stages 1, 2, 3, and 4. Stages 3 and 4 are the deep sleep stages. But you never get to 3 and 4 because what happens is you're suffocating yourself because you're not breathing. So you're waking up before you get to the stages 3 and 4. So you think you're sleeping, but you really aren't sleeping, or you aren't sleeping the way you should be sleeping. So by all means, I mean, this is an easy fix. I mean, there are already ways of doing that. It's just a matter of complying with using, the CPAPs. And so I think that if somebody has that, it's silly not to wear this and avoid having problems in the future.
I agree. So are you a fan of blue blocking glasses? They become very popular now at night. I wear them. I notice I track my sleep. In fact, I track my sleep a variety of different ways. I actually have a ring that we talked about on the show about 5-6 years ago.
Oh, yeah, I know which one. Aura?
No. There's one called Sleep On. It comes from China.
Okay.
And it does pulse oximetry, blood pressure. It does everything. It does everything except, what do they call that? Somnography. It doesn't do that. But when you wake up and look at the data, it's just amazing how rich the data is. And so I know when I'm sleeping good and when I'm not. Aura, I got to be honest. I think Aura Ring is a great device. But when I use my Aura Ring, there's a lot of times where it says, oh, your sleep was great, 99. And I feel like crap. I'm like, how could that be? I don't feel like I slept good. So I tend to stick with how I feel over everything else. I think that's more important. But with that being said, I can tell you the sleep latency. If I watch television at night and then I get ready to go to bed and I'm in bed and I haven't eaten for 3 hours because I stop eating 3 hours before bedtime. I can tell you when I take the time to wear my blue blockers, I drift off to sleep in 9 minutes or less. I go right into deep sleep and I stay there for at least an hour. I come up a little bit. I come back down again. But if I don't wear my blue blockers, I'll stay up here for probably an hour or so before I dip into deep sleep. So I can visually see the impact. What are your thoughts on blue blockers, given that other than incandescent lights, by the way, don't put out any blue light at all? I have a spectrum analyzer on my phone. I can go to a light bulb and click it, and I can tell you what it's made of. Incandescent lights are the best. We only use incandescent light bulbs in my home. I will not have LED light bulbs in the house. But what do you think about the blue blockers being part of that, realigning the circadian clock by eliminating blue light late in the evening?
Well, I mean, I think if they are really truly blue blockers, it's great. I mean, we in our studies we do really almost like those welders, right, goggles, where it filters out anything below 525 nanometers.
Right.
So you're really not getting any blue light. I think what the problem is that there's a lot of products in the market that say that they are blue blockers and they're really not blocking much. So, I think that if they are doing what they're saying they're doing, yes. And I think that a combination of light at certain times, and I call it orange glasses because the ones that I use, they're orange because they filter out so much. You see no blue at all. So if you combine those two, you actually have a more effective intervention, because it's not just about giving light, it's also removing light at certain times. And that's a way to do it, is to remove it. So yeah, if you want to continue to do your iPad at night and minimize that, wearing those. But again, I wouldn't swear by all of the blue blockers because I think there's just too many and too many claims.
Oh, so I see a lot of them that clear lenses. They claim to block blue light. So I have Evo Spectrum Pro. It's an app. I can aim it at anything. So what I do is I put this behind my blue blockers.
Sure.
Point it at the TV and I can see all the blue light is gone.
That's exactly what you want to do.
This is very valuable.
Now, I do want to point one thing out about, I agree with you that the incandescent lamp has a lot less of the blue light, but remember, it's got to be at low light level too. Because if you crank up the light level, even not having as much blue light, you still have an effect with the other ones. Yeah.
I want to take our last commercial break. I've got lots of other questions, and I also want to talk about when we can start to expect to see results from the technologies you're working on. Stay tuned. We'll be right back with more Superhuman Radio. Have you been struggling to achieve results in the gym? Trouble sleeping through the night? Overwhelmed with stress or anxiety? Look no further than Infiniwell supplements. They have designed products to address specific needs like muscle growth, hormone balance, sleep, and anxiety from the first use. Infiniwell helps you live well. Go to shrnetwork.biz/bewell, that's BEWELL, and use code SHR20 and start living well today. Remember those rectangular toaster pastries you used to love when you were a kid? Well, Legendary Foods has just made them better. The new cake-style tasty pastry is like nothing you've ever had before. With 20 grams of high-quality protein and less than 1 gram of sugar, you'll feel like you're cheating, but you're not. Go to shrnetwork.biz/legendary and use the code SHR10 to save 10% off your purchase of tasty pastries. Now available in cookies and cream, red velvet cake, birthday cake, blueberry, strawberry, brown sugar cinnamon, and hot fudge sundae. Go to shrnetwork.biz/legendary and use code SHR10 today. I want to introduce you to Tau Patch, a heavily researched patented wearable device that provides immediate and long-lasting health benefits. Tau Patch's nanocrystals convert your body heat into light of specific therapeutic frequencies that optimize your central nervous system. The health benefits of Tau Patch include relief from chronic pain, better sleep, increased focus, reduced stress, improved athletic performance, and more. Discover what it can do for you by visiting shrnetwork.biz/TAU Tau Patch. That's TAOPATCH. Use code SHR for your superhuman discount today. Is there something interfering with your happiness or ability to achieve your goals? BetterHelp can help. They will assess your needs and match you with a licensed therapist. This is not a self-help or crisis line. It's professional counseling done securely online. They have a broad range of experts and are available worldwide without having to wait in an uncomfortable waiting room. Get the help you need and start living a happier life today. Go to shrnetwork.biz/betterhelp. That's better, H-E-L-P, and receive 10% off your first month of counseling when you use the code SHR. Circadian.
New Mass Pro Synthogen X2 just upped its own legendary game. To distance itself even further from the rest of the pack, Synthogen X2 now has double the key active ingredients. If you've ever wondered what steroid-like recovery feels like, Synthogen X2 delivers. See why others compare it favorably to powerful bodybuilding drugs at synthogen.com. Mass Pro Synthogen. When you train with it, you'll gain with it.
Knoll Creek Hemp Company's Delta 8 soft chews are the premier Delta 8 product on the market today. Knoll Creek's Delta 8 is produced from high-quality hemp-derived CBD oil, and soft chews are manufactured using proprietary nano-emulsification technique that ensures the Delta 8 soft chew will timely deliver the desired effects cleanly and consistently from piece to piece. In a space where at least 70% of the products fail to meet label claims and where most users of conventional hemp products are left disappointed, Knoll Creek's Delta 8 soft chews are a product you can trust. Visit shrnetwork.biz/delta8. That's DELTA and the number 8, and use the code SHR20 to get 20% off your first order today.
You're listening to the Superhuman Channel. We're ripped and we're ready.
Hey, welcome back. We're talking with Dr. Mariana Figueiro. We're talking about light therapy and Alzheimer's and the future of this technology. A couple things I want to talk about first, and then we'll get into when we can start to expect to see this technology available. So one of the peptides I talked about a few years ago is DSIP, deep sleep inducing peptide. And we talked about this peptide and how it can actually trigger deep sleep. But the original literature that was released by a certain doctor who wrote a book about peptides was completely incorrect. He was suggesting taking this peptide about an hour before bed, 100 micrograms. Everybody who took it, their sleep was actually disrupted. Didn't make sense to me, right? Until I started to looking at literature about sleep that included the observations of deep sleep inducing peptide, did I realize that DSIP is produced in the morning when exposed to daylight. So I tried something. I took a 100 microgram shot of DSIP first thing in the morning, and I slept amazingly that night. So what we do in the morning pretty much sets the table for how we're going to sleep that night. And with that kind of as the couch for this question, what is caffeine doing to us and our sleep? Because I can tell you, when I don't drink caffeine, I get a lot more deep sleep than when I do drink caffeine.
So caffeine, it's when we first started talking in the program, sleep has two components. One is the circadian, and one is what we call homeostatic sleep, which is pretty much sleep pressure. It increases as the number of hours you're awake increases.
By the accumulation of adenosine, right? The accumulation.
That's exactly right. So the sleep homeostasis, what it does, it produces and accumulates adenosine. So what caffeine is doing is really blocking these adenosine receptors in the brain, right? So that you then don't feel that sleep homeostasis, okay? Now, the reason that you are probably sleeping more without the caffeine is that you may be having what happens is when you have a lot of sleep pressure, you allow yourself to accumulate a lot of sleep pressure, you actually dissipate that sleep pressure during your deep sleep or during your first 4 hours of sleep.
Right.
So by allowing you to accumulate more of that sleep pressure, you have more to dissipate, and you're probably increasing that deep sleep because you have more of the homeostatic sleep to dissipate during your sleep.
Now, the adenosine accumulation in the brain that causes sleep pressure is the result of adenosine triphosphate being cleaved during movement. So when you combine people who don't move all day and then they don't get natural light exposure all day, we're really pretty much setting up an absolute scenario for poor sleep, aren't we?
That's absolutely right. So it's the sedentary, and that's really why you think about older people in general, not even people with Alzheimer's, but in general, older adults. They tend to have a much more sedentary life. They don't go out as much. They're now in a very dim, constant light environment. And obviously they're getting older. So all of this is like a perfect storm for disturbing the sleep. And that's why you see so much sleep disturbances with older people. And then, back to what we talked earlier is you already have that genetic predisposition of a certain disease. You're now disrupting your sleep and everything goes the wrong way. It ends up, coming up with diseases that probably are due to this lack of movement and going out and getting light and being active. All of that is accumulating. It's basically contributing to the negative effects.
Let's take a quick question from someone who's watching the show live. It's Craig Hollander. He says, I have a genetic variant for diminished delta wave sleep and another variant for increased sleep movement. I track my sleep with my Oura ring. I don't get deep sleep at all many nights. I can't get over 5 hours of uninterrupted sleep. I've done all the sleep hacks I can. What do you think about that?
Yeah. Well, there's a couple of things. I mean, my first instinct is you should, I don't know if he has done that or not, but you should go to a sleep doctor and get a PSG or polysomnography, because that will actually tell him better what the sleep patterns are. Because sometimes, especially not being very, very regular, these Oura or these other devices are not as accurate in how much sleep, that deep sleep that you have. The second thing is sometimes, I know people that will get by with short sleep. There are people that have the short sleep genes, and that means that they can live with it. It doesn't mean that all the bad things that happen to us who don't have the short sleep gene is going to happen to the people that do have the short. So, I wouldn't panic or worry or anything, but I think the first thing is to look at a sleep doctor to make sure that it is really, you're not really getting what you think you're getting based on the devices that you're wearing to evaluate that.
I have to be honest. I said this before, and I know there'll never be a sponsor after this, but I'm not convinced that the Oura Ring tracks sleep properly for everyone. So for me, it doesn't. The Sleep-On ring and the Oura Ring, I'll wear them this same time. One night, put both of them on, and the Sleep-On ring will show me 3 different levels of deep sleep, and the Oura Ring says I got no deep sleep. And so again, I use these tracking devices to explain when I don't feel good in the morning, but I don't allow these tracking devices to override how I feel in the morning. Like if I wake up and I feel great and my sleep ring says you had a crappy night's sleep, I go, no, it's wrong. It has to be wrong, because there's no way I'd wake up feeling great in the morning, go to the gym and crush it if I slept the way it said. There's other nights where, I've only gotten 6.5 hours of sleep laying in bed for 7.5 hours. And it says, your sleep is great. And I wake up and I feel like there's cotton balls in my head. Like I can't even focus. So we put a lot of trust in these. I was just talking to Elisa today. There's just an unbelievable boom of wearable devices today that are supposed to do everything from make you feel like you've just taken a Valium to tracking your deep sleep. And they're all flawed. We have to be careful to understand that.
That's exactly right. Yeah. I mean, I think if it's saying something, then I think you should look for a physician or something and ask about it, but don't put all the trust on these devices, because they're just something that just gives you a clue, but doesn't give you the final answer.
So let's talk about your research. So now that you are embarking on these two technologies to start to use them. One to improve sleep, one to improve. The one is going to improve autophagy in the brain. One is going to realign circadian rhythm, and hopefully between the two of them, you'll correct sleep and speed along repair. When do you actually start with this next study?
We actually have started. We got the award from NIA in August, and we just we're getting ready to finish up. We're building the devices ourselves as a starting point, and we are getting started in collecting data. But we are already recruiting and running for the sleep part and the entrainment. We actually have 4 studies with mild cognitive impairment as well as Alzheimer's disease. So we're running in New York City area and the Albany, New York area. So that's I'll put in my sort of call for subjects. Anybody in this area that it's listening and it's interested in participating in studies, please contact us because we are recruiting for these studies. But for that latest one where we're combining the technology, we just started. The grant is a 5-year grant, but we hope that in 3 years we can have published data, hopefully positive. But we certainly should have some data to show in a 3-year time frame, if not earlier.
So there are actually 40 Hertz light kits being sold right now for Alzheimer's disease.
Yes, there is. There are plenty of, yes.
So if I don't have Alzheimer's disease, will 40 Hertz exposure increase the ability for my body to get rid of metabolic debris?
Yeah, it's interesting because it actually has been shown in healthy individuals looking at cognitive performance. So just the gamma entrainment per se, just independent of the clearance part, but just the cognition part, it's actually applicable to many populations, to anybody. The one thing that I think it's very tricky, and it's something that I want to work with in parallel, is the comfort of this light, okay? Because it is a flickering light. And being able to be
flickering
exposed,
lights annoy the hell out of me. Yeah,
that's exactly right. But I think that there are ways that you can deliver that 40 hertz flicker without necessarily being that uncomfortable. And that's part of
what you're talking about is the brain recognizing the flickering. So
without you perceiving the flicker.
Yeah. So if you had 6 light bulbs in a room and one of them was a 40 hertz, then chances are you may not become annoyed by the 40 hertz, but it'll do its job anyway.
Correct. So that, or you can start thinking about chromatic flicker. So changing colors. And so that's one thing that we are looking into. How is it that we can develop, because all the technologies that are being sold right now are just boom, they just flicker, and it's very uncomfortable. So what we're trying to see is, can we find a technology that it's not as uncomfortable, but it's delivering the same 40 hertz? I think that will be really novel if we're able to do that.
It seems like there's got to be a threshold for where perception of the light drops off.
Correct.
And you don't feel the discomfort or agitation from it, but you're still perceiving it. You're just not paying attention to it. So that's
correct. So that's one of the things that we're looking into it, because I think it will make it a lot easier, because part of my concern is really acceptance of these lights. If you can't accept it, I don't think it's going to be successful.
Patient compliance is everything. Whether you're going to a dietitian, whether you're going to a fitness trainer, whether you're going to a doctor and getting a prescription, at the end of the day, the patient has ultimately the last say on whether or not they apply this. And once again, this is why diseases of modernity that revolve around lifestyle are so hard to fix, because people just don't like to change what they do.
And that's the benefit of that tailored lighting intervention that we're doing for circadian entrainment. It doesn't require a lot of compliance. You just have to be in the room, because we're delivering the light in the entire room. So you don't have to sit in front of a light box, basically, right? If you're sitting on your favorite chair, you're getting that light by saying, like, we have a subject right now. She watches a TV show every day at the same time, and she's getting that light exposure sitting watching her TV show. She doesn't even notice that she's getting it. And that's what we want. We want it to be something passive, that people will be exposed to it without having to, because that's how you increase the compliance. And I completely agree with you. If you don't have the patient compliance, I mean, if you don't take your pill in the morning, it's not going to be effective.
Yeah, don't blame the pill when it doesn't work. Exactly.
That's right. That's exactly right. Yes.
Dr. Figueiro, thank you so much for being here. I think your work is fascinating, and I hope that you'll come back as you learn.
Absolutely. I'll be happy to, and thank you for having me. It was a pleasure.
Take care. And that's it for today. I'm off the air tomorrow. I'll be in the studio working, of course, but we don't have a show planned for tomorrow. We were going to do a Casual Friday, but we're going to wait one more month before we reintroduce the Casual Friday show with Elisa Profumo. So that's it for today. Remember, muscle is metabolic currency. Get into the gym and make a deposit today. The more muscle you carry, for women into their 60s and men into their 65s, the longer you will live and the longer you will be disease-free. So train hard, sleep well, and live long. And we'll see everybody next week, Monday, with more Superhuman Radio. Thanks for being here. Take care.